caregivers in some communities in your district are resisting immunization due to their religious beliefs. As a result, these communities have very low coverage rates. However, after a recent measles outbreak, some younger religious leaders have expressed concern. With effective communication, there may be an opportunity to increase coverage. Who should you target with communication activities? What messages and channels should you use? As a sub-national or district manager, you use communication to keep the community informed and involved in the immunization program. While communication about immunization should provide consistent messages, it is important to adapt your communication to different groups. When planning communication activities, you need to ask who can help you address the problem, what audience are you trying to reach, ask what messages will have the biggest impact on this audience, and ask how can you best reach this audience. First, ask who and consider the audience. Ask yourself, who can help address the root cause or problem? What groups are you trying to reach? You may often need to target multiple groups. For example, to address the religious opposition to vaccines, you may target younger religious leaders who may be more open to immunization, as well as leaders who have opposed vaccination. You would also target the caregivers who are refusing vaccination, the healthcare workers who treat these families, and opinion leaders such as village chiefs who could support your efforts. Next, ask, what is the main message to each of these groups? To help focus your message, first consider, what actions do we want this group to take? For example, you may want religious leaders to promote immunization. You also want health workers to educate caregivers and to offer immunization at every encounter. And, of course, you want caregivers to bring their infants to immunization sessions. Then consider, what message will convince each group to take this action? Use research on knowledge, attitudes, and practice, or KAP, to shape messages that are relevant for each group. Messages should be simple, clear, and accurate. You can adapt your messages for different groups, but be sure that overall, your messages are consistent and complementary. And make sure that all communication around immunization includes the message that vaccines are safe, effective, and help save lives. Finally, ask, how will you share your messages? What channels are most likely to reach each group? Consider how each group gets their information. Use existing KAP studies or ask questions to find out. Do they have access to TV, radio, or the internet? Do they use mobile phones? What about social media? Is the population literate? Do they frequently attend community events? Where does the community share information? Also consider where people live. In rural areas, the most effective way to reach people is through conversations with health workers, local leaders, community groups and volunteers, and often through radio. Let us look at different communication channels and when they are most appropriate. One of the most effective methods to share immunization information is through direct interpersonal communication, or IPC, such as one-on-one counseling from health workers or community volunteers. These conversations are also an effective method for advocacy. Use educational materials to support these conversations with clear facts about immunization and vaccine-preventable diseases. Consider the needs and literacy level of your audience. You might use a booklet to respond to caregiver concerns, fact sheets to inform decision makers, a flip chart to lead community discussions, or a poster to raise awareness and announce upcoming immunization sessions. Work with community leaders to plan community discussions or to share information at community events. In rural communities, consider traditional methods like drama or song to share basic information on immunization or dispel rumors. Use media such as radio or TV to raise awareness in the community. Finally, use social media to share information if you know caregivers are using it frequently. For example, you could use SMS messages to remind caregivers about immunization sessions. Now you know how to select the appropriate audience, message, and channels for communication activities.